After being diagnosed with cancer, Madeline learned about something called proton therapy, and her doctor says because of this treatment, she's doing fantastic.
Proton therapy is radiation.
Is a type of radiation.
Is a type of radiation.
Yes.
So a patient would not have radiation therapy, which we were talking about, and proton therapy.
Yeah, proton is the type of radiation that they're having. It's basically a more selective way of doing radiation, because the particles, proton particles, will go into the body and stop at a point where we control where it happens. And where they stop, they free up energy in the form of radiation. So it's a more selective way of doing radiation.
Now, as a patient, I would think a patient would say, well, I'd rather have the proton therapy than the other form of radiation therapy that could, maybe scatter.
Well, for many cases, there is a clear advantage for many, many situations.
Sure.
There are certain situations where we believe there is a good advantage, but we're still quantifying how much advantage there is. And that's where the trials come into play. Got it.
Okay. So there's really no concrete answer.
In many cases, yes, but there's still quantification of the benefits in others. Okay. Yes.
And that's where that team approach comes in terms of deciding what's best for the patient.
Absolutely.
Okay, fantastic. Just wanted to clarify that. Thank you so much, doctor. All right, so we've been talking about proton therapy, which is a newer therapy that can be used to treat breast cancer. Take a look at this story of one of Dr. Fagundes' patients and her experience, I got it out, with a clinical trial.
There's a growing interest to use proton therapy for breast cancer, especially left-sided breast cancer. We are part of a national study called RadComp, and it's a randomized study between proton and conventional radiation. Proton therapy is different in the sense that we send the radiation into the breast, but we stop the radiation before it reaches the heart.
I did my own research on it, and it looked amazing to me, especially if you had left-sided breast cancer. I called down here and I asked for some information, and I couldn't believe it. Dr. Fagundes called me back himself at 6:30 at night the same day.
Madeline's case is a very good example of a patient that qualifies for the study. She has breast cancer that needs radiation also to the lymph nodes, including internal mammary lymph nodes closer to the heart. So she ended up being randomized to proton therapy, and she's doing very well with her treatment.
It seems like nothing, really. The setup takes longer than the treatment. Breast cancer is a lifelong diagnosis, so I'm always going to have to be alert and aware. Cancer can be kind of dark, so you want a place where you're going to feel light and feel, I think, the building itself, the colors, everything really works to make it feel like healing and good.
This randomized study is still ongoing, and we will be looking at final results nearly 10 years after the start of the trial. And if it proves that we are decreasing cardiac complications from radiation to the point that we believe it will, then proton therapy will become the preferred treatment for these patients. I'm very excited about being part of our institution and participating in these studies, because we are determining new practices and evolving what the medical field will be doing in the next year and years to come.
And that was Madeline you were seeing, so optimistic and beautiful. How is she doing?
She's doing great.
Oh, that's fantastic. All right, let's talk a little bit about the trial that she's in. It's called RadComp. What exactly is it? When did the trial start?
So RadComp is a randomized trial where patients voluntarily agree to participate, and they will randomly be assigned to receive either proton therapy or the best intensity modulated radiation that we have. For example, deep inspiration breath hold. And the goal of the trial is to prove that by reducing the amount of radiation to the heart, in the long run, 5-10 years later, the risk of having a cardiac injury or complication from the treatment is reduced by several percentage points, so that you can ultimately say that radiation has now finally reached a point that you can eliminate cardiac induced risks or complications from the treatment.
Now, you said she finished the treatment, right?
Yeah, she finished the treatment just a few weeks ago, yes.
So how long will this trial last? Is it over?
So the trial has been open for about 2 years.
Oh, wow.
It has accrued over 500 patients. It's targeting over 1,000 patients.
Wow.
So we have the study open. And keep in mind that this is voluntary participation. If a patient comes to our center and obviously chooses to undergo proton therapy and has approval through her insurance to do so, they won't have to participate in the trial. We encourage trial participation. It's important to prove, quantify and prove the benefits, and we are supportive of trials, but patients are treated off trials also. So it's important to make that point.
And you have to be a good candidate in terms of partaking in this trial?
In this specific trial, it's only applicable for patients that we need to radiate the lymph nodes, including the internal mammary lymph nodes, So for other breast cancer patients that don't need such comprehensive radiation, they would be treated with other modalities, potentially even proton therapy, but wouldn't be this specific trial.